country, as well as the only ward specializing in treatment of patients with burns. The hospital hosted a team from the Hand Project that held a free artificial arm fitting camp. A prosthesis is an artificial body part that replaces a part that's missing or no longer functional. The device is designed to replace a missing part of the body or to make a part of the body work better. Diseased or missing arms, hands, legs, or joints are commonly replaced by prosthetic devices. The Hand Project is run from Germany, which is also where the parts for hands are manufactured. In each of the countries where they distribute hands, they work with either charities or NGOs who have the local knowledge and contacts to ensure that those in need benefit from the project. We had a chat with an orthopedic technician from the Hand Project.
My name is Ochol Andrew. I'm a professional orthopedic technologist. These are the people who deal in the technology of bones, if I'm to translate it directly, meaning most of these things like artificial hands, artificial legs, and some other artificial parts of the body, we deal in it and we normally make them like locally because we are trained locally. We have a school training us here in Mulago. Then we don't only stop there. We deal with any kind of physical disability. If you have ever heard about orthopedic rehabilitation appliances, of course, many people are used to the imported one, but we also have the ones we make locally. And of course, based on research, the locally made are more efficient than the imported one because we trust that when you assess and you make something by yourself, you know the best medication you can always give depending on your assessment and your prescription. So we do them locally as well as importing them also. The free artificial hand is a project based in Germany. The organization itself is called the Hand Project, and specifically we are dealing in the Hand Project for now. But there are times when our sponsors come in and say no. When we are coming into the Hand Project, there are people who come and say no. We also have the leg, so somehow they give the components of the leg. Now, most of these materials are just imported. However, we are looking at a progress where we can now start also making it locally. So we are in the communication with our sponsors, but this may take time, but they are ready and willing to always supply us these components so that we can serve the citizens of Uganda, not only Uganda, but the whole of East Africa and other parts of Africa, and we have moved to other countries as well to serve the citizens. For today, we have registered about 80 cases only for this location. But we are looking at over 300 cases in Uganda. And so far, based on the previous experience, we have realized that it is road traffic accident. That is the major cause of loss of arms. Not only arms, but also the legs. Basically on the women, domestic violence, and some of the cases, the armed robberies that do not attack people. Also the other cases of the Bijambia men in central here has also brought in. But when you move to other areas like maybe eastern Uganda, you will realize that because of the number of factories that were there, so most of these arms were lost because of the factory accidents. They get this, and to our surprise, none of these people are even compensated or taken care by the companies where they lost their arms. But further, when you go to the northern, you find that the major causes of this loss of arm are actually the wars that happened. Yeah, it is actually rare even to find now children who have lost their arm at this time, but the others who lost their arms those days, it was because of the war, maybe because they were chopped off during that war time, the bombs and so on. So you find out that central accident, eastern, the factories, the northern, you find more of the war. The success we have registered when we are reaching to these people is we have managed to use the government system to make sure that we can reach to these people. Like now we are in a government national referral hospital. They can actually do for us a free mobilization, free of charge, a free venue, And even we can put in some, they can put in, like now you see us getting water from them to boil our plastic if they could see from that side. So it means they have offered a part to really make these people come. And actually, like now, the biggest number we have registered is here, and it is a government facility. So in other areas, we are also using government hospitals, like Fort Portal. We are also using a government hospital, Fort Portal Regional Referral. However, in other areas, we are using the district disability officers to reach them, and other places we are using already established private orthopedic rehabilitation centers for the case of Uganda and Western Uganda. Yes, but the difficulties we have found with these people, as you know, the challenges, it's mostly with them, because these are disabled people, and you know the challenges they have is they are limited to pursue to a career where they can earn a living, meaning most of them cannot actually have some money to even reach out to get these services. And that is one reason why we cannot have one location only. Basing on our experience, we can have as many as, like, for example, we are having 2 weeks to move the whole country, so that we can reach near to them, and they also incur less transport cost to come and get these free services. However, to some extent, they are those vulnerable, completely vulnerable. They really need the hand, but they can't reach. So to some extent, we facilitate their coming. We also don't let them be here, because most have been complaining when we come there. Yes, we have come for a service, I've sold my goat, I need the hand, but again, I don't have what to eat. So we have also put in a place that we are going to be providing for them something to eat. Basically, not in terms of money, that all of us here, even the team, so we shall eat from the same food they are eating. So that is to cover up some of the challenges and the complaints. Then the stigma from the community. It is very, very much more so with the children. The children can easily copy up and use these hands, like at school, they can easily write, eat, and so on. But whenever they go to school, their friends laugh at them. Their friends, even the adults, they laugh at them and so on. But most of the people who are using these hands are those who are really in need of it. For example, I have an office where we have registered over 20 cases where I think there were about 7 ladies. The condition for them to get a job was to have an artificial hand. At least you have to look as normal as a human being. They wouldn't give you a job when you are just partially like that. So they had to call us, and we gave them the hands, and some of them got these jobs. So you realize that it is also a barrier to them to get a job, but to some extent it is also covering the gap, slowly for them to get the jobs. Being a free thing, we would wish everyone who has a potential beneficiary to come, or to at least call them to come, let them experience. You never know, this could be their opportunity. This could be a chance they have been waiting for. For our women, we know very well. Someone just comes to say, I don't need it for work. I just want to look smart. I want to look as normal, as complete. So you realize that if you tell the leg that this is a free, and secondly, as compared to the leg, I think in the whole country, or even worldwide, this has been the only opportunity that people are having to get a complete free hand. Because these artificial body parts have always been very, very, very expensive. And I think this has been the only innovation that has always been providing consistent components of free hand, either worldwide, more so in developing countries. So you realize that in most areas, people don't access this. Professionally, I can say that if you don't have 3 million, you can't afford this hand. As compared to the leg we have got very many innovators coming in, and the cost is getting lower now. But the hand, this has been the major innovation for now, and the innovations that have always come have always gone back because they cannot manage to sponsor it. So this one has been consistent. We started way back in 2019, then COVID broke us through, then we came back again.
The HAND project provides free functional prosthetic hands and arms to people in developing countries. They are simple, fit for purpose, and 100% free products that enable the team to fit all amputations from the hand to the shoulder within minutes. They are lightweight, robust, and easy to use. Each beneficiary received 2 types of hands which connect easily to a customized socket over their residual stump. The mechanical hand enables the beneficiary to hold items like a cap, spoon, fork, broom, motorcycle handle. The list is endless, thus get through their everyday lives a little bit easier. Cosmetic hands help overcome stigma. They are worn while out in public to improve their appearance and self-esteem. We were able to talk to the principal hospital administrator of Chirudu Referral Hospital, who shared a brief about the hospital and the camp.
My name is Haji Mgisha Elieza. I'm the principal hospital administrator at Chirudu National Referral Hospital. Chirudu National Referral Hospital, our main specialist areas are internal medicine, something to do with the nephrology, that is to do with the renal issues. People who are suffering from these topical diseases, HIV, malaria, hepatitis, they are the ones we are handling here. Internal medicine. But we also have got another area of specialization, which is burns and plastic surgery. For this, we house the center for the Burns Institute. For people who get burns, we get cases as far as from Kasese, as far as from Barara, from Kabale, all the parts of the country. They refer most cases here where they have got complicated burns. And then our team does plastic surgery. Then, of course, we also provide other general surgical services. Then we also provide the maxillofacial. We have specialists who deal with issues of dentistry. We have a maxillofacial surgeon. We also have got ENT surgeon, and also have got the specialists in terms of the ophthalmology, eyes. Then, of course, on the side of internal medicine, which I didn't complete, we also house the biggest number of dialysis beds in the country. We have 30 beds here in Chirudu. They're located on level 8. I don't know whether they've been able to reach there. So in addition to the ward, that works as an outpatient clinic, but we do some procedures in that clinic as well. And in a day, we do about 60 to 80 sessions for dialysis cases. Of course, we do also other things to do with internal medicine, issues of hematology, issues of gastroenterology. People who have problems in the stomach. We have a specialist here who handle that. Then HIV and AIDS. Issues to do with the nutrition and others. So and then of course we have also created, we have for instance at Medical Assessment Center, that's where we handle the general conditions, because you remember this was a health center for and serving the people working in the division before cabinet or government made a decision to transform this into a national referral hospital. The people in this area used to come here to get primary health care services. These include treatment for coughs, for diarrhea, for these simple ailments that affect our communities. Now we have what we call the Medical Assessment Center, which is reserved to treat those conditions which were being treated here before. It is now a bit improved because we have got a specialist to oversee that area, but of course he works with a number of doctors, a number of nurses, and other staff. Chirudu National Referral Hospital normally works with partners. We collaborate with quite a number of other partners. And we have partners in that area of burns and plastic surgery. We get quite a number of cases, people who suffer accidents. They are all referred, a number of them are referred here. Particularly even if they go to Mulago, they worked on Mulago and other places. But when it comes to fashioning those areas, the rims, the stamps, they are referred here, and then our team does the fashioning. So what you have been missing are the limbs to fit on either the arms or the legs. So the hands project came in to support our unit, and we are very happy that now they have turned around the lives of many victims, many people who suffered this. Now, when they get free arms, they're able to work and be able to enjoy life, not exactly as it was before, but at least much better than it would have been in the absence of these limbs. So the arms are important. They help our people who have been who have suffered accidents, because they have accidents, either burns or road accidents, any form of accident that can take away people's limbs. And we are happy with the team, that project, which is sponsored from Germany, to come and make the lives of Ugandans more better, more functional, to restore the functional state of these individuals. Jude Hospital, as a national referral hospital, is a bit a young hospital. We started this facility as a self-accounting entity in 2019-2020. So we are basically making like 5 years. We have like the physiotherapy unit. I don't know whether I've been able to see the physiotherapy unit. Our physiotherapy unit would be able to undertake some of these activities, like fitting these limbs of these individuals, and in terms of even training them on issue of functionality, or even replacing and other things. But we need to, now we're going to be discussing with the partners to see how can they help us with to start up this unit using the physiotherapy unit, because as of now we don't have the equipment to manufacture or to fabricate those rims. That's why these guys are coming to support us all the way from Germany. We are happy as the Children's National Referral Hospital and on behalf of the people of Uganda for this kind of collaboration. We want to enhance it to ensure that one, we establish a functional unit that can be able to fabricate these limbs, whereby Ugandans can be able to access them free of charge, or at a subsidized cost. Because currently, I think in the Kampala they are available in Mulago, but of course, the price again is not because these items are not supplied by the National Medical Stores, which supplies most of our drugs. Most of the things they are used, leather, some iron bars, some items that are outside the medicine list. So we are sure that because government has been giving us a lot of support in terms of medicines, that's why now when you come into the clinics, you see the numbers are big. Numbers are big because we are able to get medications for them. Government has been able to provide medicines for them and other supplies. But we also want to believe that the government will still support us to ensure that we set up this facility, to ensure that these people, our patients, get a full package.
We also talked to Dr. David Wambi, a plastic surgeon with the Burns and Plastic Surgery Unit, which is among the specialty departments established in Chirudu Referral Hospital.
I'm Dr. David Silva Wambi. I work with the Burns and Plastic Surgery Department here in Chirudu, and I am a final year plastic surgery fellow. This is the second, but I think this is more massive than the previous one we have had before. In the field of plastic surgery, the numbers of specialists are very few in the country, and yet the demand for the services is quite high. So because of that unmet need, usually there is a training gap. So I was pushed to do plastic surgery to be able to bridge that unmet need for plastic surgery specialization in the hospital. But given that gap, the department cannot handle patients as they come in. So patients have a very, very long waiting time to access plastic surgery services. And then also they have to move distances to access the hospital because it's only here you can get the services free. So we also kind of struggle with numbers, and we utilize such camps to be able to reduce on the backlogs of our booking lists. So we really rejoice having such activities because they help us to see so many patients in a very short time, and we are able to relieve patients of the long waits for access of plastic surgery services. I would say it's not easy to do such a mass mobilization, but being the only national burns center, we receive so many patients, so it gives us contact most of the time. And through our outpatient that runs every day, Monday to Friday, we're able to talk to the patients and notify them of our upcoming activities. This is one of them. And then also we use social media handles for the hospital, and also our own social media handles to notify people about the services. So those that follow us are able to get to know about them. And for the few, we are able to do radio campaigns, put up some few posters like that. I will say we have a very long booking list for reconstructive surgeries here in Chirodu. And if you wanted to book a surgery now, it may not be possible. You may have to wait for at least 2-3 months for an elective procedure to get onto the list. But in such instances, we expect quite a good number of patients. More than 100 will be coming in for this camp for fitting of hand defects. And then you should also appreciate that in the country, we do not have a very well-developed hand surgery program. So most of the patients do not have access to the prosthetics, prosthetic devices. They know when your hand is gone, that's all for you. Yes, but when we have such programs and we tell them about it, they are usually happy to benefit. In plastic surgery, we usually deal with our colleagues in the orthopedic side who do the actual amputation surgeries. And for those that we feel we can spare the hand, we try as much as possible to spare the hand, because your life is actually your hand. If you don't have a hand, you cannot function in society. You can't shower, you can't feed, you will struggle with most of the domestic routines. So as plastic surgery team, we try to make all efforts to spare the hand function. But in those cases where it's really inevitable to lose the hand, we have no choice. The orthopedic team will support us during the amputation, and then we can support you with the reconstruction or the aftercare. I expect to see most of the patients that I've interacted with during this time in our clinics and our routine consultations who have undergone several amputations at different levels, to see them have their hope of having a functional hand restored, and to see them get active again in community with something that can equate to what they lost in the surgery.
Some reasons why you might need or want a prosthesis include traumatic injury requiring reconstructive surgery, cancer requiring removal of a body part, amputation due to injury or disease, congenital present at birth defects, long-term wear and tear of a body part like arthritis. While prosthetic arms and hands cannot fully replace a natural limb, they can support users in many different and valuable ways. Tune in next time for yet another episode where we talk to a beneficiary and others who are going to benefit from the service.